Well, back with us now to give us an update on all things that matter about your health is Lynn Herr, the Vanderburgh County Health Department. Good morning, dear.
Good morning.
Thanks for being with us on this technology. This is how we stay connected these days.
I know.
Lynn, let's talk about, let's start with flu season and getting those flu shots and the importance of it.
So we want everyone to get their flu shot this year, especially during COVID season. And that's because so many of those symptoms of COVID and the flu are the same. And so it'll be much better for us to identify COVID if people are not having the flu. And the last thing that we want that to happen also is for someone to have the flu, be immunocompromised, and then turn around and have COVID, or vice versa.
Or vice versa. Where are flu shots typically available for folks?
You know what? If you have insurance, we know that you can go to pharmacies and you can go to your primary care providers. If those children that are on Medicaid and not private insurance, you're welcome here at the Vanderburgh County Health Insurance. And we do take some private insurances. So please feel free to call. And then also those local pediatricians. For those adults that do not have insurance, are not covered at all, please call the Vanderburgh County Health Department and we'll see if we can't get you a flu shot. Then we also are going to have several drive-ups. Our first one will be mid-September with a deaconess, and there will be 2 lines so that we can serve those folks with insurance and those folks without insurance.
What a great opportunity for everyone. Do we have to sign up, pre-register for that, Lynn? Or just
Yes, and there'll be a press release coming out very soon, Angie, as soon as those details are completely ironed out.
Is the flu vaccine available now? Can we get our flu shots now?
It is available now. And we also want our seniors to know that those individuals over the age of 65 may end up needing that stronger dose of flu, and they just need to talk to their primary care provider to see if that's a right fit for them.
Yeah, I mean, I had it the last 2 years, and I think it's been really great. Haven't been sick, so yay, that is super. Let's kind of update us on where we are in COVID right now in the tri-state.
So we really, we had a large peak right after the 4th of July, where we were seeing 50 up to 60 cases a day. We are down to in between 20, around 20. 25, and we really hope it's because everybody has really embraced that mask wearing and social distancing a little more seriously. We will continue to watch those numbers after this holiday break, and just want everybody to know that while it's a holiday weekend and we want everyone to have a great time, we do need to not let our guard down and social distance and definitely wear our masks.
Definitely. Just that good reminder, because, it's just not our nature to stay distant from each other, especially with friends. So just be aware that it works. Social distancing works.
Yes, and unfortunately, COVID, those individuals are, when they do get the virus, are asymptomatic and definitely asymptomatic those 2 days before symptoms, and that's when they're contagious the most. So it's not that people intend on making their friends and family sick, it's just that they don't know.
There's so much we don't know. Lynn, thank you so much for being with us this morning. Have a good holiday weekend. Stay safe.
You too, Angie. Bye now.
I'll talk to you soon. And we'll be back with more Lifestyles right after this. Please stay with us.